So in this video we will explain the bile. What is bile? Okay, the bile synthesis. In bile contain bile acid. What is bile acid and what is salt? What is the difference between them? Okay, what is the bilirubin? Bilirubin and unconjugated bilirubin, conjugated bilirubin. All of these things we will explain it. Okay. So all these things will be explained in this video. Okay. So first of all, we will explain bile. Okay. Bile in bile, this is contain bile acid, bilirubin, cholesterol, and phospholipid. In bile, these are contained, and also it's also contained water, that is mostly water. Okay. Electrolyte, also contain electrolyte and xenobiotics. Okay. These are contained in the bile. So first of all, we will explain the bile acid formation, how bile acid is formed and how bilirubin is formed. We will explain these two things. Okay. And what is bile acid and bile salt? What is the difference between them? So bile acid is actually synthesized in the liver. Okay. So how it formed? It formed from the cholesterol, and it comes from the chylomicron acid flow. And when the cholesterol formed and triacyl acid, from the cholesterol it formed the bile acid. Okay. From the cholesterol here is formed. It is formed from the cholesterol. The bile acid is formed. So you have to remember that bile acid is of two forms. One is the cholic acid. Another is the chenodeoxycholic acid. So these are the two forms from the bile acid. Okay. These are the cholic acid and chenodeoxycholic acid, and these are called primary bile acid. These are actually primary bile acid. When these become deoxygenated, when oxy group removed from them, so this is called deoxycholic acid, and deoxycholic acid, and lithocolic acid. Okay. When oxygen group is removed from both of them, okay, so what will happen? This is called deoxycholic acid and this is called lithocolic acid, and these are called secondary bile acid. So you have to know that what is the primary bile acid and what is the secondary bile acid. Primary bile acid are cholic acid and chenodeoxycholic acid, okay, and secondary bile acid are deoxycholic acid and lithocolic acid. So if I show you that how it is formed, okay, for example, if I tell you that how these are formed, their structure, then you will remember that cholesterol. For example, if you see the cholesterol are four-ring structure, okay, like this is the four-ring structure like this, okay, and to this carbon, here is the hydrocarbon chain attached to it, okay, 1, 2, 3, 4. So these are the cholesterol, and when this cholesterol they in the liver, okay, it's not in the plasma, there are two types of enzyme. There are one is the CYP7E1. This is the one enzyme. What this enzyme do with the cholesterol? Actually, this attach oxygen group OH group to this 7. This is also called 7-alpha hydrogenase. So they attach carbon to this 7th carbon. Okay. So you have to, and here it's will form carboxylic acid, C.OH, and there is the OH group attached to here. Okay, and this is present here. So this is called cholic acid, chenodeoxycholic acid. Okay. So 7YP7E1, and when they move, when the cholesterol act, when the CYP act on the cholesterol, and after this another enzyme act on that is called CYP8B1. Okay, 8B1, CYP8B1. When this enzyme act on it, what it do? It is also same, but it actually do attach two hydroxyl group, one on the 7th, one on the 7th. Okay, sorry for example, this is the rings for carbon. So this actually attach OH to this group and also to the 12th carbon number. Okay, so this enzyme is also called alpha hydroxylase. Okay, so this is called cholic acid, chenodeoxycholic acid and cholic acid. These are two compounds, okay, chenodeoxycholic acid and cholic acid. But after this, you have to ask from yourself. Now this is the formation of the chenodeoxycholic acid. So this is the primary bile acid. Okay. Now if you come to the secondary, how the secondary is formed. So for example, chenodeoxycholic acid, when deoxycholic act on it, and it convert chenodeoxycholic acid to the primary, that is called lithocolic acid. It converted to lithocolic acid, and cholic acid into the deoxycholic acid. So these are the secondary bile acid. Now what is the bile salt? Okay, and another thing the liver function is when this is bile acid is formed, what it do? It actually go here and the conjugation. In liver metabolism, you have to remember that in liver metabolism there are two phases. One is the modification, another is the conjugation. These two things occur in the liver. Modification, for example, bile acid converted into bile acid is formed from the cholesterol. This is just modification. In the conjugation, there is other group that is attached to the bile acid. Okay, so for example, this is your bile acid. So in the conjugation, what will happen with it? So these are two compounds attached to it. One is the glycine, and another is the cholic acid, another is the taurine. Glycine and taurine attached to it, and it form. This is called conjugation. So you can see when glycine is attached, you have to just add glyco. But if taurine is attached, you have to add taro group. Okay. So taro, for example, there are we have seen here, there is the chenodeoxycholic acid. If the conjugation of this is occurred by glycol, so it is called glycochenodeoxycholic. If it is attached by the taurocholic acid, so you have to tell the name is taurocholic acid. And for taurochenodeoxycholic acid, if the glycine is attached to cholic acid, so this is called glycocholic acid. If taurine is attached, so this is called taurocholic acid. So this is this conjugation, the compound that it formed after the conjugation. In conjugation, the bile acid is converted into the form of glycochenodeoxycholic acid, chenodeoxycholic acid, and glycochenodeoxycholic acid, and taurochenodeoxycholic acid, glycocholic acid, and taurocholic acid. These are the conjugated compound, okay? And this is actually salt, bile salt. These are not acid. They can form the bile salt, okay? So this is the bile salt. So we have bile salt. The above is the bile acid, okay? Chenodeoxycholic acid and sodium, and these are attached on the salt. Now, yes, this is all things about the bile acid, okay? Now, what is the bilirubin? Bilirubin, okay? And also another thing you have to remember, another important thing that you can remember, that with bile acid, for example, when this is formed, okay, bile acid, they secrete through the pancreatic, through the bile duct, to the second part of the duodenum. So they move, and what is the, now we will explain the function of the bile, okay? So in function of the bile, now function of the bile, function of bile acid. Bile acid actually, for example, this is your fat compound. Okay, they're surrounded by this fat molecule and form a micelles, and they can easily absorb through small intestine. Okay, but you have to remember, if there is a liver disease, where the bile acid is not produced. Okay, when the bile acid is not produced, the fat cannot be absorbed. Okay, the fat cannot be absorbed after, when there is a liver disease and the bile acid is not released, the fat cannot be absorbed easily by this. And another thing is that if there is cholesterol, for example, cholesterol, when high level of cholesterol is present, in your body, bile acid, for example, when this is the pancreatic duodenal part, okay, here is the bile acid. The bile acid is act here, release here, okay, and when after releasing, it move on the two part. One is the enterohepatic circulation, another is enterohepatic circulation. Another is moved through the feces, but that is so small amount. Okay, 95% bile acid is moved to the hepatic circulation, so it conserves the cholesterol level. But if in the body there is a high amount of cholesterol, so what can we do? We do tablets, okay, that actually combine with the bile acid, and mean when it combine with the bile acid, it convert bile into not soluble, okay, and that cannot be absorbed easily, and it moves through the feces from the body. Okay, now the next important thing you have to remember is the bile formation of the. Now come to the bilirubin. We will explain the bilirubin, okay, from the basic. So first of all, how bilirubin is formed. There is your red blood cell, okay. In the red blood cell, when 120 days is completed of the red blood cell, it actually destroys. And in red blood cell, there is the hemoglobin. Hemoglobin is present in your RBC, okay. And hemoglobin convert it into the heme and globin. And globin convert it into the amino acid. Heme convert it into the heme convert into the iron. So for now, heme converted into the porphyrin and iron. Okay. Now another porphyrin converted into the biliverdin by heme oxygenase. Okay, and biliverdin converted into the bilirubin by biliverdin reductase. Okay, so the bilirubin is formed. Now another thing, important thing is the bilirubin. Bilirubin is insoluble in water. In water or in blood. That is actually water. So it is insoluble in blood. So what it do? It actually the plasma, there is the albumin. Albumin is present in the plasma. So there is the albumin. For example, this is your albumin. Albumin is present in the plasma, and actually albumin transfer bilirubin into the liver. Now we will come to the now this is your what? This is your albumin. Albumin, okay, and bilirubin. Here is the bilirubin. Bilirubin is attached with the albumin, okay, like this. This is the bilirubin and albumin complex. They move through the blood. For example, this is your blood. They move through the blood from the spleen, etc. Where the RBC is broken down. Move through the blood and move into the liver. For example, this is your liver. Falciform ligament, coronary ligament, triangular ligament. Okay, so they move through your blood, and these both complexes, what it actually do? They move. So in the liver, you have to remember three things. You have to remember the simple mnemonics are A, B, C, and E. A, B, C, E. A mean activation. B mean binding to cytoplasmic proteins. Okay, and C mean conjugation. E mean excretion. So first of all, these complex move to the liver. And albumin is removed from them, and so bilirubin is activated. And after, when it moves to the hepatocyte, okay, what it can do? It actually bind to the cytoplasmic protein. Okay, after that, the conjugation of bilirubin occur. And when conjugation of bilirubin occur, from this, here is the bile, here is the gallbladder bile duct move from here. It moved to the bile duct. And then excreted. Okay, and then excreted to the duodenum. First part in the duodenum, and then excreted to the feces, and some go to again to the enterohepatic circulation and move through the blood toward the kidney. toward the kidney and excreted as a urine. Okay, so now this is all about bilirubin. So now we will explain the normal bile. In the normal bile, for example, this is your liver, your normal bile metabolism. So first A, B, C, conjugation. When it moves binding to a cytoplasm, conjugation. In conjugation, this is your bilirubin. Okay, and bilirubin is actually not water soluble. So in the conjugation process, what it happens with it? In conjugation process, conjugation is performed by UGT enzyme. UGT is the abbreviation of UDP, glucourynyl transferase. Glucourynyl transferase. Okay, it converts the bilirubin into the conjugated bilirubin. Conjugated bilirubin. So this is the conjugated bilirubin. You also call it conjugated bilirubin. And the unconjugated bilirubin, this is called unconjugated bilirubin. And another important thing is the direct end. This is the unconjugated bilirubin is also called indirect. Okay, and this is called direct. Conjugated because it gives direct one bar test. One bar test. Okay, direct one bar test. If you do one bar test, it give you direct. Okay. Now this is just about the normal mechanism when the conjugated bilirubin is formed. Okay, what it do after it is less soluble. It is soluble. Okay, this is insoluble in the blood and this is toxic and this is less toxic. Okay, so now again, so for example, when the conjugated bilirubin is formed, this is your liver. In the liver, there is the lobule, etc. Everything is present, and there is the hepatic duct. Okay, hepatic duct, and from the hepatic duct, this bilirubin move to the hepatic duct and hepatic duct. Okay, this is the hepatic duct, and from the gallbladder, it attached to the gallbladder. Cystic duct. This is the cystic duct, and the hepatic and cystic duct combined form common hepatic duct. Okay, common bile duct. Okay, CBD, common bile duct. CBD, common bile duct. In this bile duct, they move and they attach with the pancreatic duct. Sometimes they attach with the mostly attach with the pancreatic duct and open it to the ampulla. And here is the duodenum second part. In this part, they move to the duodenum. Okay, they move to the duodenum and act on it. So, for example, when here the bilirubin come here, what it do? It actually in here the bilirubin convert into the bilirubin. Bilirubin come here, it convert into urobilinogen. Urobilinogen. This urobilinogen, for example, when they come here, it actually here is a microbe convert bilirubin into the urobilinogen. Urobilinogen, after it convert it into stercobilin. Stercobilin get moved through the feces. Okay, in the feces color is the brown color feces. Okay, the color of the feces is due to the stercobilin, and urobilinogen convert into the urobilin. They absorb from the small intestine and move to the portal vein system, and again it moves to the blood, Okay, move to the blood, and then it ultimately move to the kidneys. The kidneys urobilinogen move to the liver, and from the liver it convert into the urobilin, and they excrete in the kidney as a urine. Okay, so now urobilinogen convert into the stercobilin and urobilin get excrete as a urine. Okay, and some are regenerated and move like this. Okay, so now this is the enterohepatic circulation. In the enterohepatic circulation, this is your kidney, and from the kidney the urobilin move to the this is your liver, and from the intestines the urobilin move to your hepatic. So this is called enterohepatic circulation. This enterohepatic circulation also present the bile acid. Okay, bile acid regulate bile acid, and bile acid move like this. Okay, so this is so simple mechanism I have explained to you. Now we will come to the jaundice. Okay, so what is jaundice? Jaundice is actually the yellowish of sclera of the eye, skin, and mucus. Okay, this is just jaundice is derived from John's mean yellowish. Okay, so actually jaundice is not a disease or disorder. It is actually a symptom. It is actually a combination of symptom. It is actually a symptom of different type of diseases. Okay, so when there is increased bilirubin, increase, okay, it causes yellowish. Okay, jaundice. So this is the simple mechanism. Now we will explain how bilirubin will increase in the body. Okay, so we have already explained that bilirubin is formed from the red blood cell. And red blood cell, it converted to the this is unconjugated bilirubin. This is converted to the conjugated bilirubin. Okay, conjugated bilirubin. Now another important thing is this is converted by UGT enzyme, UDP glucose transferase. Okay, now if this enzyme decreases, so the bilirubin, the unconjugated bilirubin will be increases. Okay, so you have to remember something. Remember that unconjugated bilirubin. Remember the RBC. Okay, UGT. Well, you have to remember UGT enzyme. Another this conjugated bilirubin is present in the liver. When they move to the bile duct, how it moves to the bile duct? Here there will be a transport, and that transporter is called that transport. For example, here is and that transport. What is that transport? MRP2. Okay, MRP. Here is a transporter. So there is a transport. There is the MRP2 transport. Okay, and you have to remember that this is your bile duct. This is the bile duct. So in the hepatocyte, there is a MRP2 transporter that move the conjugated bile into the duct. And here is another transporter. For example, this is your blood. This is your blood. Okay. And to the blood side, there is another transport present that is called MRP3. Okay. MRP3. And the conjugate will move like this to here. Okay. And now you have to remember these are things. One RBC, another is the UGT enzyme, and the third is the MRP2, MRP3. Okay. So what it can now jaundice, type of jaundice. Types of jaundice. One is the pre-hepatic. Actually, when in the liver, for example, this is your liver, and there is a problem in the liver. So liver cannot metabolize the bilirubin. Okay, so the bilirubin and cannot move it to the bile duct and to the intestine and cannot excrete it. So the bilirubin level will increases, and when bilirubin level increases, there will be cause jaundice. So now you have to remember there is type of jaundice. One is the pre-hepatic. One is the pre-hepatic jaundice. Another is the hepatic jaundice, and the third one is the post-hepatic. Post-hepatic jaundice. Now I have write this pre-hepatic, hepatic, and post-hepatic. Now you have to remember simple words. Post-hepatic is related with the obstruction, and pre-hepatic is related with the hemolytic anemia. Okay, and hepatic is related with the liver disorder. Now, so hepatic can be caused in the liver cirrhosis. For example, if there is a liver cirrhosis, this can be caused in the liver cirrhosis. If there is hepatitis in the liver or infectious in the liver, then that jaundice, the bilirubin mechanism will be disturbed, and that is called hepatic jaundice. In hemolytic anemia, when the RBC, when there is abnormal RBC are ineffective, when there is a hemolytic anemia cause and ineffective erythropoiesis. When the ineffective erythropoiesis not occur in the correct manner, so it will cause hemolytic anemia. And when there is obstruction in the bile, for example, this is your bile duct, and there is obstruction in the bile, so this obstruction, the bile cannot move here, and the backflow of the bile will move through a backline. Okay, and this will move to the blood and will cause jaundice. Okay, now we will explain the pre-hepatic. In the pre-hepatic, pre means before hepatitis. So if there is no hepatic disorder and the jaundice is caused, how it's happen? One is the physiological jaundice. When the baby born, okay, it have low UGT enzyme is very ineffective. It's ineffective, and that is called physiological jaundice. And now when the baby grow up, actually the jaundice will become cured its form. Okay, and then is the pathological jaundice. In pathological jaundice, we have first of all we have to when the RBC level increase, and there is the hemolytic anemia cause. In hemolytic anemia, the unconjugated bilirubin will be increases, and this unconjugated bilirubin move to the liver, and when it move to the liver, more conjugated bilirubin is formed, but there is the overload on the liver. Okay, so the unconjugated bilirubin will be increases so much. Now another thing is the ineffective erythropoiesis. If the erythropoiesis is not occur in the correct way and it's not in the mature world, so many RBC destroyed, much of the RBC destroyed in the spleen, and it will move the component to the liver. Okay, and that causes jaundice bilirubin. Okay, so this is the pre-hepatic. And an important thing you have to remember that in the pre-hepatic there is increase in the unconjugated bilirubin. Okay, and there is no enzyme AST, ALT elevation. Okay, there is no enzyme elevation. So actually this pre-hepatic is the hemolytic. So pre-hepatic are hemolytic. So what increasing is, so hematocrit is below 45. Okay, another is the hemoglobin level will be decreases. Okay, hemoglobin level will be increases because RBC are destroying again and again. In the total bile, we will explain the total bile. One is the conjugated bilirubin and one is the unconjugated bilirubin. Okay, so conjugated is the direct bilirubin. Here you have to remember that the conjugated bilirubin, this is the conjugate, the unconjugated bilirubin will be increased so much. Okay, and direct bilirubin or conjugated bilirubin is normal. That will be normal. That will not be increased. And urobilinogen also increase because when the unconjugated bilirubin increase, it will move to the kidney and more urobilinogen will be formed. Okay, so this is the hemolytic anemia, and this is the cause is mismatch of blood hemolysis or membrane defect. If there is membrane defect in the RBC. Now, so this is all about. Now we will see hepatic. In hepatic, for example, this is your liver. In hepatic, what will happen? So in hepatic, when there is a disorder in the liver, for example, hepatitis or fibrosis or scarring, anything that is present in the hepatic. So for example, in hepatic, the total bilirubin increase or not. So first of all, that is the direct bilirubin increases. In the hepatic, the direct bilirubin increases, and indirect bilirubin is also increased. For example, when there is a disorder in the hepatic, so the unconjugated bilirubin will increase because it cannot move to the liver. And another is, for example, this is your hepatocyte. In the hepatocyte, there is the conjugated bilirubin. For example, this hepatocyte destroyed. So this conjugated bilirubin will leak out from this hepatocyte and move to the interstitial space. In the interstitial space, it moves to the blood. Okay, so the conjugated and unconjugated, both of them will be elevated. Okay, this is the simple mechanism. Now, we will explain the AST and ALT. AST and ALT level will be increased, but you have to remember that ALT is specifically for liver. AST is also present in other tissues, but if there is AST increases, then ALT 2 2 times than ALT. So this is called, you have to remember, this is due to alcohol. This is due to alcohol fatty liver disease. Okay, so this is actually hepatic. In hepatic there is dilute bilirubin, indirect bilirubin. This is called, it also called hepatic encephalopathy, but we don't explain that things. Okay, now the cause is the alcohol. It cause is alcohol. Cause is alcohol. Autoimmune hepatocyte, autoimmune disorder. Okay, now we'll move to the post-hepatic. So now about the post-hepatic. What is the post-hepatic? If there is no increase RBC destruction, no liver disease. Actually, in post-hepatic, what will happen? For example, in post-hepatic, this is your liver. Okay, in the liver, the post-hepatic circulation. For example, this is your cystic duct, this is your bile duct, the hepatic duct, and they form the bile duct. Okay, so if there is an obstruction. If there is post-hepatic means obstruction or impairment in flow or bile duct. If there is impairment in the flow or in the bile duct, that is called post-hepatic or obstructive jaundice. Okay, so now for example, if there is a obstruction here, if there is a cystic cholecystitis, if there is a gallstone, okay, and they block this area, okay, so there will not be a jaundice, okay, but these move, if they move to here, if the cystic duct and this region, there will be a blockage, okay, and this blockage increase the bilirubin level, and that is called post-hepatic. In post-hepatic, the unconjugated bilirubin will also increase, and the conjugated bilirubin also increase, okay, and you have to remember, if there is increase in the conjugated bilirubin, there also be increase in the bile salt, okay. These two are very important. You have to, if there is increase in the conjugated bilirubin, then the bile salt also increase, and the bile salt cause itching and bradycardia. These are two things you have to remember. If the bile salt increases, if the conjugated bilirubin increase, then the bile salt also increase, and this cause itching and bradycardia. Okay, so this is so simple. I have explained the pre-hepatic and post-hepatic. Okay, now what is remaining? Post-hepatic. We have explained the post-hepatic and pre-hepatic. Now, if you go to the treatment, in the treatment, what can you do? In the treatment, you have to move to the underlying cause. You have to move to the area where from where this jaundice is derived. If this is the pre-hepatic, post-hepatic, or hepatic. If that is the hepatic, you have to see liver cirrhosis or other thing. You have to first treat that underlying cause. You have to treat that underlying cause. That is the treatment. In the pre-hepatic, there is a hemolytic anemia. With the hemolytic anemia, you have to work on the and give the drugs that is related to hemolytic anemia. And post-hepatic. In post-hepatic, there will be surgery. Surgery is important, and the post-hepatic patient are going toward the surgery. And in the surgery, the bile duct and other that is blockage, they will open their blockage. Okay, so these are the simple things I have discussed to you. So if you like the video, please like and comment. Thanks for watching. Okay.